The state unveiled its timeline for distributing a COVID-19 vaccine, and here to discuss it with us is Dr. Daniel Koritzkis, Chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good evening. Good to see you, Emily.
So as expected, this timeline prioritizes healthcare workers, long-term care facilities in the first phase. What do you think of the plan, and what challenges could come up as it's implemented?
Well, I think the plan is a good one. I think the priorities are appropriate. The challenges are really how do you distribute vaccine to all these people? How do you make sure that not everybody gets vaccinated on the same day so that if they do have a reaction, you don't have a lot of people having to stay home from work at the same time? And how do you make sure that everybody comes back for their second vaccination?
Okay, still things to work out. The general public, most of us, can't get the vaccine until April at the earliest. What is the message to them, even if they're going to be around people who have been vaccinated?
The most important thing is we know what you can do now to protect yourself from getting infected with COVID-19. Wear a mask, be careful about what settings you find yourself in indoors, stay within your own immediate family, and you will eventually get the vaccine. It's just going to take a little bit more time for everybody to get vaccinated.
And you should keep those measures up, even if, say, you're with your grandparents who got the vaccine before you did.
That's absolutely right. The big thing we don't know about the vaccine is, does it just protect you from getting sick, or does it protect you from actually getting the infection? You might become an asymptomatic carrier of the virus if it doesn't really protect against infection per se.
Okay, what about someone who has already gotten COVID-19? Should they get the vaccine?
We think they probably should. The recommendation at the present time is not within 3 months of having acute COVID, but if it's been more than 3 months, then yes, you should get vaccinated, because we just don't know how long your natural immunity is going to last and how long you might be protected.
Okay, all really important points. I want to ask you finally about this news out of England today. Health authorities saying there that people with a significant history of allergic reaction should not get the Pfizer vaccine. 2 healthcare workers had this reaction. What do we know about this? Is this a cause for concern?
We don't know a whole lot of the specifics yet. I don't think it's a big cause for concern. In the randomized trials, where 43,000 people were studied and 21,000 got the vaccine, there was no significant difference in the rate of allergic reactions between those who got the control, the placebo, and those who got the actual vaccine. If people have concerns, they should consult their primary care provider before getting the vaccine.
Absolutely. Great advice. All right, Dr. Koritzkis, thank you for your time. We appreciate it.
Sure thing. My pleasure, as always.